دكتور هشام الأكحلي استشاري القرنية مستشفى المغربي هيقدم اليمني اكسبيرينس من أحمد جلوكوما بن. تفضل يا دكتور هشام.
ايش البرزنتيشن ايش؟ على طول. هذاك طافح يا دكتور. Yemeni experience on Ahmed valve glaucoma and refractory glaucoma. Okay. This is our doctors in Yemen who done Ahmed valve. Dr. Assam Shamahi, he talk about his experience, and Dr. Ibrahim Hamdi talk about his dark side. And now I will talking about Dr. Muhammad Al-Himyari, who do many cases in Maghrabi Hospital. What is the refractory glaucoma? It's a term used for any kind which has not response to any to the medication or surgical treatment. So they need subsequent surgical re-intervention. This is the most glaucoma drainage device, Ahmed glaucoma valve. This is Abdul Mateen Ahmed, who invented this device. He is a biomedical engineer. All this character of Ahmed valve designed to prevent excessive drainage and immediate reduce of intraocular pressure in all types of refractory glaucoma. There are two types, FB8 used for children and FB7 used for in adults. You can use Ahmed valve intervention as a primary surgical procedure in neovascular glaucoma and post-PKB and aphakia and pseudophakic glaucoma, pediatric glaucoma and vitreoretinal surgery and uveitis, or in failed secondary procedure trabeculotomy. What is the goal of this study? To describe short time of Ahmed valve. I mean, etiology of refractive glaucoma, the surgical success and failure rate, and the complication and factors that influence this surgical success. The study design is retrospective, cross-sectional hospital-based, taken during the March 2021 and May 2022 in Maghrabi Hospital. The criteria, the pre-operative visual acuity must be at least less light perception and follow-up less 3 months, and the patient diagnosed with primary or secondary refractive glaucoma. The demographic data, I will take this. Okay, the complication, hypotony is considered below than 5 milligram mercury, and early complication considers the first 3 post-operative months. The surgical success is mean the intraocular pressure is above 6 or greater and 21 or less without use of additional and anti-glaucoma medication, without loss of light perception or happening devastating complication like suprachoroidal hemorrhage. The surgical rate, one of these, loss of light sensation or withdrawal of the valve or the need for further surgical intervention. The statics use this. The results, the mean age is about 35 years old. The most main age group is the middle age, 18 and 60 years old. The gender is commonly equally. The male is more. The systemic disease is more diabetic. Okay, this is the various previous eye surgery. The most common is trabeculotomy, presented by 35%, followed by cataract and retinal surgery, 24%. The mean follow-up duration is 5 months and 4 years. The the mean percent drop in the intraocular pressure from the pre-operative record to the post-operative last intraocular pressure record was 57%. This is very high decrease in the intraocular pressure. This is graph showing the mean number of glaucoma medication. This is pre-operative anti-glaucoma medication number is about 3.87%, and this drop post-operative after 1 year to 2.26. And this is another graph also showing the mean intraocular pressure during the follow-up duration. As you see, this is the 38.3 is the pre-operative intraocular pressure. This dropped to the 11.4 in the first day. Then after 1 week, they elevated to the 13.2. And from the first 1 month to the 6 months, there is a stability of intraocular pressure from 17 to intraocular pressure, but this is elevation is at a case of hypertensive phase. This is a case of hypertensive phase. After that, after 6 months or the last visit, there is a very stability of intraocular pressure about 15 degree. Okay, this is the diagnosis of refractory glaucoma according to the presiders. If the primary procedures, the most common is neovascular glaucoma. The secondary intervention for Ahmed valve is pediatric childhood glaucoma. Okay. Okay. The most place for Ahmed valve is anterior chamber. 2 cases only put it in the sulcus, both aniridia and both childhood cataract glaucoma. The presence of complication is about 7 cases and present by 30%. This complications tube exposure and the pleb, and they took Dr. Mohammed Al-Himari talking about this. Early complication is about 53%. And this most important is a hypertensive phase, 35%, as I talk. And the second is hyphemia, and this hyphemia usually with no vascularization. The surgical success rate after 1 year is 92%, and 4 cases has failure rate because of these factors: presence of complications and significant p-value, also the location of Ahmed valve, especially in the sulcus. A group, the A group less than 9 years old presented 3 cases of surgical failure. Home message: Ahmed valve implant was safe, effective in refractory glaucoma. The hypertensive phase peaked in the first to 6 months, and this need anti-glaucoma medication. Thank you.